Okay, we just did an update on our research on our patients who've had the mini gastric bypass. I'm going to report that to you. Actually, those of you who are here in the clinic, I just did this, so that was a dry run before we actually do it on the video. One of our former patients came back to work with us. She's a medical student from Canada and had the surgery, and so we were scrambling for a tool to help educate her during her month of her rotation with us, and we gave her options of reading and doing a report and things like that. But one of the options that we offered is we could do research on a topic related to our mini gastric bypass patients. And one of the nice things is having 5,000 patients is if you send out a survey amongst those 5,000 within a few days, you can get hundreds and hundreds of answers back, which can begin to help us address different questions. And we've actually been doing this now for over 12 years, and the interesting thing is our results are the same. Our weight loss and complication rate, patient satisfaction, those things continue to show the same results over time. So that's, we think, kind of exciting. And one of the things that our student brought up is her request that we consider our diabetics. I think you said you might, when you match for your residency, become a family practice doc in Canada, and you'll see a lot of diabetes. And so one of the things that we thought is we would analyze our patients' response to a survey about the mini gastric bypass and diabetes. So this past weekend we created a survey, sent an email out to several hundred patients, and we got back let's see, 629 answers from Friday night through this morning at Tuesday morning. And so that's a pretty remarkable study. Lots of scientific studies. There's one in the Journal of the American Medical Association on diabetes, obesity in adolescents, and they had 25 patients that they studied. So 629 patients, pretty good. And we're going to talk about a lot of this research and can't go into all of it this morning. But one thing that we found that we think is new that we talked to you about a little bit is that what happens in the mind as well as in the body of our diabetics. What we did is we looked at our diabetics based on how long they were from the surgery to the time of our survey. And for this entire group of patients, there were about 192 patients who had the mini gastric bypass in 2007. And when we looked at that group, we asked them, are you a diabetic before surgery? And as I say, about 100 or 92 patients said, I was a diabetic before I had my mini gastric bypass in 2007. Then we asked them, okay, how about after the surgery? And 85 out of the 92, which is 92.4 or about 93%, said, I'm not a diabetic after the surgery. So I had the MGB in 2007. Now in 2010, in January and February, I am no longer a diabetic. So 93% cure of diabetes over a 3-year period. This is where you guys applaud. Going to have to be better at this. So 93% success of curing diabetes, pretty remarkable. Pretty remarkable. We could kind of test that by asking another question. We could say, you know, are you taking medicine for your diabetes? Okay. And not surprisingly, 92.4% said they're not taking any medicine for their diabetes. So the question, are you diabetic and are you taking medicine for diabetes, match. Because that makes sense. But the interesting thing is when you go to 2008 patients who had the mini gastric bypass and said they were diabetic before their surgery in 2008, we asked them, now 2 years later, are you a diabetic? And 16% said yes. So 7% of the 2007 diabetics said they were diabetic, but of the 2008 group, over double that number said they were diabetic. But even more interesting, we looked at the question, are you taking any medicine for diabetes? And the answer was only 7%. So the function of taking medicine for diabetes was a 93% success in both 2008 and 2007. But if you ask a patient, ask a diabetic, are you diabetic? In 2 years, you still believe in some of those patients. You still feel like a diabetic, even though you're taking no medicine for it. And as we talked about, a lot of people take some time to get used to their new body. They feel heavy. They've been heavy for 10 or 20 or 30 or 40 or 50 or 60 years. It's hard to get adjusted to being thin. And in the same way, it looks like diabetes is something, according to our recent research, that takes a while to get adjusted to. Even though it looks like, as measured by whether you need medicine for diabetes or not, the diabetes is successfully resolved as far as needing to take medicine for it in 93% of people. It takes a little while for you to get your head around that idea. So kind of exciting new research, and we'll keep you up to date as some more of this stuff comes in. So thought I'd give you an update on that this morning.
Very good.